Since California first legalized medical marijuana in 1996, 35 other states have followed suit. Now, Iowa and every state bordering, except Nebraska, has some sort of locally overseen program. Illinois is the only border state currently also allowing recreational sales. Iowa's medical cannabis program began with a trickle. In 2014, legislation allowed neurologists to prescribe cannabidiol or CBD oil in certain cases of pediatric epilepsy. Products contained only slight amounts of the psychoactive ingredient THC. With limited guidance from the state, the confusing measure sunset in 2017. Since then, a complete overhaul and incremental adjustments have expanded Iowa's Medical Cannabidiol Act to include more health conditions. Industry stakeholders applaud the progress but say hard work remains.
The market really kicked off in Iowa December 1st, 2018. And from there, we've been able to supply products to the various dispensaries across the state from then. We've gone through a lot of changes. We've been able to remove a THC cap that used to be on the program, now allowing full levels of THC in any of the products.
Lucas Nelson is general manager of Des Moines-based MedFarm Iowa, the state's sole approved medical cannabis grow operation. Iowa law presently allows for up to 2 such enterprises, but the other already folded, and a more recent replacement isn't up and running yet.
Every single plant in the entire facility has to be tracked in real time by our electronic system and by the state.
There are only 5 state-sanctioned dispensaries in Iowa, and MedFarm is the supplier for them all, including competition in Council Bluffs, Waterloo, and Iowa City, as well as their own locations in Sioux City and Windsor Heights.
The number one thing we see in here is pain, whether that's chronic pain or acute pain.
Dispensary manager Stephen Wilson says at first, new cannabis patients arrived on his doorstep as a last resort after they'd run through a slew of other pain medications. Now some doctors suggest trying cannabis before harder prescription drugs like opioids. But hurdles remain, particularly for many income-restricted sufferers.
I think the most important thing to realize is this is an expensive product that is not covered by insurance. Opiates are often, very often covered by insurance, and a patient may pay $5 for a bottle of oxycodone, hydrocodone, where out of pocket, they may pay $50 to $100 per visit.
Currently, Iowa patients must be state certified via a healthcare practitioner and pay up to $100 annually for a medical card to authorize purchase of any products. MedFarm would like to bring the cost down, extend the term, or both.
Well, I was thinking about trying this.
Under 8,000 Iowans are registered as medical marijuana cardholders, less than a fraction of 1% of the state's population. Product choices are limited to topicals and oral forms like tinctures and pills, but no edibles. Vape oil, once restricted, has surged in popularity, but Wilson says patients are pushing for more.
Most other medical cannabis programs are going to have flower. Iowa doesn't currently allow for us to manufacture or sell flower products. If we're able to do that, prices are going to naturally fall. It's also important to keep in mind that we're a very young medical cannabis program. Our prices are not dissimilar from where Colorado, California, Illinois, Minnesota all started out as well.
A half-gram vape mix of high THC and low CBD sets Iowa patients back about $75 after tax, while in Colorado and California, similar items can be found around 66% less for about $25 per unit. Nearly all other prescription drugs, almost nationwide, are not taxed.
It's very expensive to operate in this state currently.
While MedFarm remains under its original ownership, 2 of the 3 other dispensaries in Iowa have changed hands, and for one, their previous Davenport location after those businesses shut down.
They have to buy permits, they have to get licenses, and that all costs money, which takes off of how much profit you get. The black market, they don't have to deal with any of that. Those people have their network, they're making their money. They're not going to change just because the state made it legal.
56, I am showing a pretrial supervision violation.
Ahead of the Illinois legal weed kickoff New Year's Day 2020, Dubuque County, Iowa Sheriff Joe Kennedy said his primary concerns along the state border were impaired drivers and illegal product coming back across the Mississippi River. But law enforcement in border areas like the Quad Cities say the move by Illinois hasn't significantly elevated crime statistics. On Iowa's northwestern border, South Dakota voters approved dual-track legalization in November 2020. Governor Kristi Noem left medical approval intact, but sued on a technicality to keep recreational use illegal. Ultimately, the South Dakota Supreme Court sided with Noem just before Thanksgiving 2021.
It looks to us that the legislature in South Dakota will probably still end up passing some kind of a recreational cannabis program anyway.
Dane Schumann is a lawyer who lobbies Iowa lawmakers on behalf of MedFarm, which involves keeping an eye on pot-related developments nearby.
We see the impact that Illinois' program has had on the medical program because we can track how many patients in Iowa's medical program there are within each county. And if you look over at Iowa's eastern border, the amount of medical patients has completely stagnated since January 1 of 2020 when Illinois' program went live.
Many of us have been in that situation where if we're in pain or someone in our family or that we care about is in pain, we'll do anything to help that.
Industry and medical experts believe one of the biggest risks for patients who choose to engage black market scenarios, besides Iowa's zero-tolerance statutes, is product purity.
What you're seeing here is some of our THC oil that's being distilled. This is important because in our products we have ratios of CBD to THC. We've developed and honed this process over the several years of operation. Despite that, we're always trying to dial it in to get our yields better, get our purities better, and be able to do this quicker as well.
MedFarm does their own extensive safety testing before paying for mandated state analysis. Due to Iowa's flower restriction, all raw marijuana must be processed into oil before manufacturing, further driving up costs. Nelson says lifting the ban would bring his company closer to a full range of products and help nudge the state toward parity with neighbors like Minnesota, the state which Iowa based its program upon. The alternative to allowing flower in the Hawkeye State for MedFarm could be expansion into friendlier marijuana business climates, which would send additional jobs and tax revenue to out-of-state coffers. Nelson would prefer to grow the business in-state.
We have no intention of leaving, and we're really proud that we are Iowans. We're all from Iowa, have connections to Iowa before we started working here at MedFarm, and I think that makes us maybe a little bit more uniquely dialed in to understand what this state needs.